Dr. Gottfried. Sara, welcome.
Thank you. So happy to be here.
Yeah, I'm delighted and very excited to ask you about an enormous number of topics. You are expert in so many things. So the challenge for me is going to be to constrain this walk, as it were. But I'm hoping that we can touch on a great number of things today. The first of which is really about hormones and female hormones in particular. And I have a question, which is it ever informative for a woman, regardless of age, to know something about her mother's, perhaps even her grandmother's experience vis-a-vis hormones, not just pregnancy challenges with or ease with pregnancy and child rearing, childbirth, this sort of thing, but what sorts of conversations should women be having with themselves and with family members to get a window into what their specific needs might be?
Love this question. So my work is really at the interface between genetics and environment. So your question gets to both. And I think it's essential that you understand what your grandmother went through. I'd even say your great-grandmother, depending on longevity in your family. So I grew up with my great-grandmother, I get that. And especially your mother. So I would probably start first with trauma and intergenerational trauma, because I think that affects the endocrine system so hugely, especially cortisol signaling, but the broader PINE system, psychoimmunoneuroendocrine system. And then there's, if I think about the stages, the life cycle that a woman goes through, if you think about puberty, I don't know how genetically determined the age of puberty is. Certainly there's a lot of environmental influences, like toxins can affect it. But pregnancy, the age at which you start to go through perimenopause, menopause, many of those have a genetic component. So with pregnancy, you can certainly think the shape of the pelvis, your ability to have a vaginal birth. So micronutrient testing, what I usually do is a combination of blood and urine. And so I'm looking at all of the micronutrients that we can measure that have some clinical scientific basis behind them. If I could do that for a teenager, I think it might be helpful, because I recently gave a lecture on breast cancer risk reduction. Another quick sidebar. And I was sad to find that intake of vegetables, polyphenols, is such an important predictor of future risk of breast cancer, like when you're 50, 60 plus. And the most important time is when you're a teenager. Now, I have one daughter that eats vegetables. She loves them. And I have another daughter who eats food that's beige. And it's very hard to get her to eat the volume of vegetables, 5 colors a day, which is what I do. And if you have evidence that you could show a 17-year-old that they've got micronutrient gaps, I think that would be a motivator for them to eat differently at a time when it's so critical. Even though it's, 25 years in the future, that it's going to potentially change this arc that they're on.
What do you do for a young woman who doesn't like vegetables or is not somehow able or willing to get those 5 colors a day of vegetable to help support the microbiome? Are supplements a useful tool in that case? What other sorts of tools, behavioral or otherwise, are useful?
Such a good question. So here I'm going to invoke Rob Knight at UCSD. So I think his gut project has really been helpful in terms of understanding what kind of modulators are going to be important. So what I try to get that person to do, and I don't see many teens anymore other than NBA players, what I try to get them to do is to have a smoothie. Very hard to get them to have a smoothie every day. But if I could get them to have a smoothie 3 times a week and to throw some of these vegetables in, that makes a huge difference. We know that makes a difference in terms of microbiome change.
Just people blending up broccoli or kale.
Cauliflower. So cauliflower is great.
Even they're putting things into the smoothie.
I don't know if you can get a teenager to do that, but they often will use, I have them do steamed broccoli that's in the freezer because it's got very little taste. So that they could do that in a chocolate smoothie. They could add some greens. I like greens powders are super convenient. So that with, kind of a taste that they like, whether that's chocolate, which is what most of my clients want, or, vanilla with berries and that sort of thing. So that can go a long way if you don't like vegetables. And short of that, I would say some supplements, but I would say that's a distant second to making a smoothie. I've got one patient that I have to mention because he took this to the extreme. So he's a retired physicist professor at UCSD. He found out that his microbiome was a hot mess and developed autoimmune disease. And so he became hell-bent, like only a physicist could, on changing his microbiome. And he dramatically shifted it by having a smoothie every day with 57 vegetables and fruits in it. So
57 independent.
57 independent. So, this just warms my heart, the way that he did this. But he would go to the farmer's market. He would just get a bunch of this, a bunch of that. And he would go home, make the smoothie, and then stick it in the freezer. So he'd have a serving every day. And he became a completely different person based on this microbiome change. His autoimmune disease is in remission. He dropped a huge amount of weight. He went from being, kind of this phenotype that I know you know well, of a professor, high performing, traveling around the world on so many boards, so much innovation, so many great ideas, supercomputer guy, to being someone who gets up in the morning, gets in his hot tub, exercises for like 1 to 2 hours a day.
So
that they may not know about.
So PINE, the
PINE system,
right? Psychology, immunology, neural, and endocrine factors combined. Is that?
Yes, and then I would say there's another factor, which is being female is a health hazard. So we have twice the rate of depression, insomnia. We've got 3 to 4x increased risk of multiple sclerosis. We've got 5 to 8 times the risk of thyroid dysfunction. So if you just look at that and you look at subtle preclinical thyroid dysfunction, a huge number of the women that I take care of, well, let me back off. A large number of the women that I take care of have thyroid dysfunction that's contributing to constipation. And if we go back to that control system, the hypothalamic, pituitary, adrenal, thyroid, gonadal, gut axis, and they have a lot of perceived stress together with this borderline thyroid function that no mainstream medicine doctor has told her is a problem. And then she's got a problem with the tango between estrogen and progesterone. She's going to tend toward constipation. Women have a lot more constipation than men. The gut is about 10 feet longer in women compared to men. We should talk about some sex and gender differences and define those.
Sure.
And they are much more likely to have a tortuous colon. And the way you know that is you get a colonoscopy and they tell you, yeah, it was really hard to get in there and do what we need to do.
As a brief tangent, but I think this is the time to ask, at what age now do physicians insist their female patients get colonoscopies? For men, I think the age used to be 50. Now it's getting ratcheted back to 45 or 40. Again, these are recommendations, not requirements, but they're pretty strong recommendations from depending on where you live, et cetera. For women, how early do you think they should get a colonoscopy to explore for possible polyps and or colon cancer?
Yeah, it's a really good question. I don't know the answer. So what I've always operated with is 50. The way that I answer that is to go to the U.S. Preventive Task Force rating to determine, based on their synthesis of the data, what age is the most appropriate. Has it changed, as you just described, for men from 50 to younger? I don't know. So we should fact check that.
All these additional health hazards for women. You mentioned you broadly mentioned psychological impact, right? And of course, these things are all related, psychology, immunology. And one of the, I think, wonderful things about neuroscience and science in general and medicine is that there's now an understanding that all the organs are connected to one another.
It's a network.
It's a network. And that the microbiome sits at a key node within that network. And I think most people accept that now.
Yes.
That seems to be a theme that, at least in the last 10 years, is really wonderful because certainly for neuroscience, it was thought that, unless it's in the cranial vault, it's not neural, which is ridiculous because there's lots of nervous system outside the skull. But in any case,
Can I interrupt for a second?
Yes, please.
So I think you're right that there's an understanding about the network effect. But I think that as much as I love mainstream medicine and I trained in it, and I'm so grateful for my education,